I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambekar, and recently I made a video talking about if you have a negative sentinel lymph node biopsy, meaning you don't have cancer in your lymph nodes, there's still an 8 to 10% chance that the cancer could come back in the breast or somewhere else in the body within 10 years. And someone commented, well, if chemo does what it says, then I don't get how it can come back. So for those of you who are new here, this is a picture of a sentinel lymph node biopsy. It means taking out the 1 to 3 lymph nodes that the cancer would spread to first if the cancer were to try to spread outside the breast into the lymph nodes. It does not mean removing the lymph nodes which are physically the closest to the cancer. It means removing the ones that this lymphatic channel would take cancer cells to first. So most patients who end up having a sentinel lymph node biopsy and one of the lymph nodes does have cancer in it are estrogen and progesterone receptor positive, and then this test, the Oncotype test, gets sent. And then you would get a score report like this. This Oncotype score is high. It is above 26, and there's a 20% chance that this cancer could come back somewhere else in the next 9 years if this patient decides they want to take a hormone blocking pill alone and does not take chemotherapy. And then there's an above 15% absolute chemotherapy benefit, at which point the medical oncologist would recommend chemo. This Oncotype score for this patient who does have cancer in one of their sentinel nodes is saying that the chemotherapy is going to work and is going to reduce this 20% chance down to something in the order of 5 or 6%. But taking chemotherapy and taking the hormone blocking pill does not guarantee that the cancer won't come back somewhere else in the body. Unfortunately, there can be cells that escape both chemotherapy and the hormone blocking pill, and they wait for your immune system to be down for some other reason, and then they start growing somewhere else. So while it is a very small percentage of patients who, after taking chemo and taking the hormone blocking pill, see their cancer come back somewhere else, it does happen to some. So far, we don't have any treatments that are guarantees. There is no breast cancer where we can say these are the types of treatment we can recommend and there is a 100% chance that this cancer will never come back. I'm hopeful that things like cancer vaccines will make that chance 100% in the future at some point.